Thank you, everybody, for joining us back here at Atyr Pharma's channel. We're sitting here once again with President and Chief Executive Officer, Dr. Sanjay Shukla. Previously, Doctor, you and I talked about your past and how you got kind of involved with the company. But today, I really want a solid overview of Atyr Pharma. How are you doing? Are you ready to get into it?
Sure, Michael. Fire away.
Perfect. So start off clean and simple. Give me the elevator pitch for Atyr Pharma.
Atyr's Pharma, our mission is to take discoveries from tRNA synthetase biology. It's an ancient class of enzymes, and we are generating medicines from this platform biology that we own. We developed, we discovered, and now we are developing therapeutics, mostly targeting inflammatory and fibrotic diseases, also some forms of cancer. So that's really our mission here at Atyr. The company was founded by a gentleman named Dr. Paul Schimmel. Paul is a revolutionary in biotech as a scientific entrepreneur. He has founded some transformative companies such as Alnylam, Repligen, Alchemies, Cubist. These are multi-billion, 5, 10, $15 billion companies. But his life's passion has been really always around this ancient set of enzymes that are in our body that he discovered play a very, very different non-enzymatic role in basically helping us control our immune environments. And that's what we do at Atyr. We basically learn from this new biology. We own all of the platform knowledge from this biology. And we are writing a new chapter in an immunology book that when I went to medical school has yet to be written. So it's very exciting to be able to harness these discoveries and really mature them into drug candidates and now potentially life-changing therapeutics.
It's always really interesting to see when science, biology, and everything is kind of pushed to you're on the frontier of it, so to speak, and that's got to be an exciting thing for you guys as well.
Exactly. It's not only trying to figure out where to position the research with regards to a clinical trial or a therapeutic indication, but we are also learning so much about the technology, the biology. And as leaders in tRNA biology, we have a 10 to 15 year head start of other companies that are just entering the field, that are viewing this as a new class of potential medicines. Having found a significant win here with pulmonary sarcoidosis, we are looking to other areas of our platform and where could we go from there. Now that we have validated one of these fragments working, we think we can create many more medicines from our platform.
Yeah, you had mentioned the company. Talk to me more about Atyr Pharma as a business and like what is your guys' business model as a whole?
So our model is really to first create a strong IP estate around these proteinaceous fragments. So, Michael, in all of our bodies, we have these enzymes which are called tRNA synthetases. And what these enzymes do is they're basic construction workers. They help us make proteins, and they are each assigned a specific amino acid that they have to shepherd to a tRNA, and they help conjugate that reaction. So a very simple kind of construction worker.
Yeah.
I got to take leucine or glycine, and I got to take it over here to a tRNA. I got to catalyze that reaction, and then I'm out. And we have about 20 of these. That's about the 20 amino acids. What Dr. Schimmel discovered is for some reason these enzymes break apart into fragments, and those fragments migrate outside of the cell and move to different parts of our bodies, different tissues, different organs. And there they play a different role. They kind of have a role at night. So they're construction workers by day, but at night they seem to be these immune policemen. And there they basically help control local inflammation, fibrosis, maybe even the development of cancer. And we own IP, a solid IP estate of over 200 of these fragments. The first one we picked to move forward is the one that we have seen some outstanding clinical data. But we're excited to look at the other 199 that we have in our estate. And recently we are advancing a few of these because we've learned they could play a role in fibrotic disease, helping control things like liver fibrosis or kidney fibrosis. So we tend to take a very data-driven approach. I told you that's my style from the last time we spoke. And we follow the data. We don't have a set narrative written. So we don't say we're a company that's going to cure this disease or that disease. We are a company that has this biology platform, and we expect this to yield multiple drug candidates over the years. And our expectation, and Dr. Schimmel's expectation, is we do become that next transformative company, like an Alnylam that revolutionized RNA medicines 15 years ago.
Yeah, yeah. So tell me more then about where everything is sitting so far. Tell me a bit about the R&D and the pipelines of things, where they are so far, and really what that means depending on the phase that they're in.
So early on, what you do is you do quite a bit of work to characterize these proteins. You want to really be able to map them, look at the crystal structure, and really understand, okay, how do they basically, what's the 3D look of these proteins? A lot of that work is done here in San Diego, but we also have a strong collaboration and a lab in Hong Kong that does a lot of the early sort of work to basically map out what these proteins look like, their shape, their crystal structures. Once you understand that, you can start to get into, okay, what do they bind to? And we have found that many of these proteins start to bind known ligands or receptors in our bodies. And then that starts to then give us a clue on where we want to go. So what we have found is many of these proteins start to bind receptors. And then we look to validate that, because that takes some time. Recently, we validated a separate synthetase fragment from our IP library, one of these proteins. It binds a fibroblast receptor that is largely seen on cells like natural killer cells. So then you start to put the pieces together to say, okay, here's what the structure looks like. Here's what it binds to. Then you start to understand, okay, where might this be useful, this interaction, in what kinds of diseases? But between there, you also have to see some functional, it's got to do something. So it's got to be able to either push immune cells away or bring them, over. And what we've learned is, at least with our lead candidate, it seems to do a really nice job as an anti-inflammatory. We have another candidate that seems to basically call immune cells, over. It's a signaling mechanism. This could be useful in cancer, where you want to actually have more immune engagement. So what we're learning from our library, broadly speaking, is it is a really next generation, what I would call a natural intelligence platform. We talk about artificial intelligence. This is our own bodies, our own immunophysiology that we are basically tapping into, which conversely, I think, makes our program make more sense biologically. We're tapping into areas of biology that we're just trying to fine tune and help people who sometimes don't tolerate well. Maybe it's a inflammatory disease of the lung. Maybe it's something in their liver. We all have different epigenetics. And this might be a way to sort of tune things back to restore that immune balance. And that's precisely what we're doing. As a small company, we'd love to look at all 200 of these, but we are now marching forward with, I would say, dozens of these fragments. But it takes time. It takes time to learn the biology and really be careful of not moving in a direction too fast, because that's what happens sometimes in biotechnology. Companies sometimes move too fast without really understanding the science, and then you make mistakes once you get into the clinic. You don't have the readouts that you expect.
Yeah, fair enough. Well, you had said, I feel like one of the things that kind of puts you in a spot to prevent stuff like that is, as you said, you guys are very data driven. You're not working at trying to solve some very large narrative. You're in a process of discovery, which I find very interesting. It's like a journey. So I guess now we kind of understand the business model. We understand some of the technologies behind things. Can you tell us what the real opportunity is for people looking at Atyr Pharma as investors or potential investors?
I mean, the opportunity here, broadly speaking, is to get involved with a company that is just not a single asset company or a single disease indication company. We are a company that is building what we think is an arsenal of therapeutics, but we're doing so based on following the data and not positioning ourselves as a respiratory company or a cancer company. Because as we learn what these fragments do, they might be useful in a kidney disorder. or a brain cancer. We don't know that yet until we can actually really interrogate that science. So we are akin to those companies that really transform biology. So you look at those companies where you discover a new area. You know, decades ago, we didn't know what interleukins were, what cytokines were. These are known players in immunology, and we are really writing that chapter on what we think is the next frontier of novel immune therapeutics. And because they are coming from our natural intelligence, we think we have an advantage there. This is not something that is coming from elsewhere. It's coming from our own bodies. It's really just understanding our biology. And then, as I said, understanding which patients may have things out of balance. And then we basically can restore that balance by administering these therapies, which sometimes can be what we call as modality agnostic. Sometimes we can take this fragment, attach it to a piece of an antibody, and that way we can enhance the PK characteristics. Other times we may want to actually look at that receptor reaction and say, we may want to create our own antibody that has more affinity. And we've done both of those approaches by looking at that receptor. Sometimes we learn the interaction, for example, downregulates, and we say, that could be useful if we upregulate it. So then we create a monoclonal antibody to turn it on. So really what we are is a company that follows the science, is very thorough in understanding that science, because that allows us to de-risk our opportunities. So a large amount of opportunities with our IP estate, but also a strategy to de-risk, so that as we move into preclinical and clinical testing, we make less mistakes. And I think some of that has played out here over the last 5 years with our efzofitimod program.
Wonderful, Sanjay. Well, I feel like you did a great job of walking us through a general overview, and everybody will dive more specifically into different parts of the technology and everything, the more of these videos that we do. But I do implore you guys, if you have any questions, I knew I did when I was first getting into this stuff. It's very interesting. Don't be afraid to leave them below, whether it's on the technology side, the business side, biology side. Don't be afraid to reach out and join the conversation. Sanjay, is there anything else you want to add before we go today?
All I want to say is this is complex biology. I try to basically simplify it for myself in my mind. Really complex biology, but I think what we've done here at Atyr is we have a process. We have a process in which how we have can mature some of this technology, because that's another important thing. You can be sitting on a lot of technology, but you don't know how to actually turn it into something viable. That's something that I think we have learned. It's taken us some time, but I think it's something that for all the viewers out there to understand that this is complex biology to understand, and we try to break it down on our website. I encourage folks to also send us questions, because we've got a great research team here in San Diego that really loves to dive in and learn.
Perfect. Could not have said it better myself, Doctor. Everyone, don't be afraid to submit questions and join this conversation, please, and stay tuned for more videos coming soon. Doctor, thank you so much for your time today.
Thank you.